H. pylori, I think, is the #1 cause of acid reflux. Here's what you don't know about it. First, the tests often miss H. pylori. Now, the breath test, the blood test, the stool test, in my opinion, are not the most accurate. The most accurate and the gold standard in medicine is to do an endoscopy and take a biopsy of the tissue inside your stomach. But what you have to know is, first, you have to be off those PPI medications for at least 15 days. Otherwise, you have a 56% chance of getting a false negative. That's more likely to get an incorrect result than a correct one. Second, it's also worth noting that when they do the biopsy inside the stomach, they don't biopsy the esophagus or the mouth or the tongue or the tonsils or the teeth where H. pylori can silently live. In fact, as far as I'm aware, there's no current test for it in those regions, and you could be swallowing it, it could be interfering with your sphincter and causing your reflux. In my clients, especially when they've taken long-term PPI drugs, because that increases the chance that you catch it, I like to rule it out with some Pylopurge. I start with 1 capsule before breakfast and slowly build to 3. After 2 weeks, if you don't see an improvement, I open the capsules into water so you can swish it around your mouth, gargle and swallow. Remember, if you have a hidden H. pylori bacterial infection and you don't try something to treat it, and that's causing your reflux, you will never get better. Best of luck.